So in an unvaccinated individual, what will happen? Nowadays, we are giving vaccinations in the private practice. We are vaccinating most of the children with varicella. In case the child has not received even a single dose of varicella, the child has not received, most of them will experience a rash. Okay. Most of them. Subclinical varicella is very rare. I told you 85-90% is a secondary attack rate. Similarly, most of them who are exposed to a child with varicella, most of them will have a rash. Okay. Almost all exposed will experience a rash. There is no question of subclinical varicella at all. So fever, malaise, anorexia, headache can be there, a mild abdominal pain can be there. So typical viral prodrome will be there for the first 2 days and then the rash will start. So the other symptoms, that is fever, systemic symptoms, will start slowly coming down once the rash starts. So the rash usually starts from the scalp. So it starts on the scalp and then it starts descending down. So the face, trunk, everything, limbs, everything will be involved except the palms and soles. It is very pruritic, and because of this pruritus, intense pruritic rash, sometimes it can lead to bacterial superinfection of the rash also. So that is also possible. Okay, and I told you there are various stages of the rash. Initially there will be macules, then papules, vesicles become umbilicated, then the rash will start crusting and then scarring. So various stages of rash can be seen in a single individual. So that is called as a pleomorphism of the rash. So the rash distribution, I told you, it is a centripetal towards the center, and mostly it will be in the trunk and sometimes on the extremities except palms and soles. It will involve the oral cavity also. Enanthems are also possible. It can involve other mucosa like vaginal mucosa also. It will involve the conjunctival, but corneal involvement is rare. So the average number of lesions is somewhere around 300 per person, and the new crop of lesion can keep continuing, can keep coming till 1 week. It can keep coming unless we treat right away with acyclovir to decrease the number of lesions. So the differential diagnosis for a varicella exanthem, we have to think of other viral rashes, especially herpes, retroviral rash, pox like monkeypox or a rickettsial pox. Although monkeypox or rickettsial pox will have a very large lesion, not a very small, not the tiny vesicles that we see in varicella. So bacterial infections, again impetigo can be confused with varicella rash. Drug reactions, especially diclofenac, painkiller induced reactions, which will cause typical maculopapular rash beginning to form vesicles. So that is also a drug reaction which is similar to varicella. Some contact dermatitis, insect bite allergies, hand, foot, mouth disease, all these are other differentials for varicella rash.